chest pain, shortness of breath, or just not feeling right. How do you know when it's an emergency?
Welcome to What Brings You In Today, a podcast from SGMC Health.
I'm Kara Hope Rockwell.
And I'm Erica Bennett. And today we have Elizabeth Flail, DO, an emergency medicine physician with SGMC Health. So Dr. Flail, what brings you in today?
I'm here to talk about emergency medicine and the reasons that we should be coming to the ER, the urgent care, and just kind of overall the health system from the standpoint of being chief of staff. So excited to be here.
Thank you.
All right, well, let's start off with your background. Kind of tell us what led you to even become a physician.
So my dad was an emergency medicine physician, and he practiced right here at South Georgia Medical Center for 25 years. So I remember as a child thinking what my dad did was pretty cool. I remember being stopped as a kid and people being like, oh, you took care of me in the ER, thank you. Staff and the nurses just always being so, warm and welcoming. So at a young age, I remember being very fond of his career. But it was really my mom that told me when I was entering high school, I was 15, she was like, I want you to shadow your dad. I was thinking about being a physical therapist, maybe a vet, medicine. I knew I wanted to do something in sciences, but I didn't know what. And so I shadowed him, and I was hooked on patient number one. We had a VTAC arrest, and he was shocked. He came back to life. He had a STEMI. He went to the cath lab. He lived. That does not happen every day in the ER, but it happened on my first patient encounter with him, and I was like, wow. I mean, what purpose in life to be able to save someone's life, right? You're there in a time of need, in a true emergency, you make a difference. And I was like this, no doubt, I was 15, that's what I was doing. So the rest of my whole life really has been a mission and a purpose of, becoming a physician and on that career path. And my mom actually really set me up with mentors to get me there. I shadowed Kim McGow, a pediatrician here in town. She was my pediatrician.
Me too.
And she has no idea how much of an influence she's made on my life. And then Dr. Corson, the OBGYN, huge impact on me, and Bridget Moore. So I got put up with just strong women that really let me know I could go into medicine and I could do this. So that's kind of how I got here.
I think it's so powerful to be able to see other women doing that, and whether it's in your specialty or not, and just know that, like, oh, I can achieve that because they have.
Yes, all moms, two of them having 4 kids, and very involved, parents. They live for their kids, so they had a huge influence on me.
Yeah.
Mm-hmm. And so you were hooked on emergency medicine did you ever consider any other specialty?
I love peds. I still love peds, but I get to see kids. But it was actually Dr. McGow that said, don't do peds. She was like, running a business in an office is challenging. You get to see plenty of peds in emergency medicine. I think you're going to like that career path. So I remember getting into medical school and really loving peds. And I called her, and she was like, don't do it. And so I didn't even question it. I was like, I'm going to take her advice. So here I am.
And did you know you were going to serve in Valdosta, or did you think you were going to do something?
I'm going to be honest with you. I did not immediately when I left UF. I did have this picture of going to the big city and having this career. And I took a job up in Atlanta. I was on a partnership track, and I was going to have this amazing life in the city. And then, life has this way of sometimes just kind of, hitting you in the face. And so my son, Weston, was 2 at the time. And I actually, unfortunately, diagnosed him with cancer. He was sitting on the couch with me, and he rolled over to my hand, and I palpated a mass. And I was like, oh, my gosh. And I was like palpating it around. I was like, it doesn't cross the midline. He doesn't have any symptoms. And I just remember Tony was sitting right there in that chair, and I just looked up at him. I said, I have really bad news and I have really good news. I was like, Weston has cancer. I was like, the good news is it's really treatable. And he was like, what are you talking about? I'm like, I can feel it. It's what it is. And he was like, it's not. He's constipated. I was like, that's not what it is. So he actually went up to my place of work, and we got the ultrasound, and of course was Wilms tumor. That's what I told him he had. And we got transferred to CHOA. And he had a nephrectomy and chemo and very intense 10 months of my first coming out into practice in this dream job I thought I was going to have. And it was Valdosta that reached out to me. My friends from Valdosta, I don't want to cry. And they were so good to me. And I just thought, life's too short not to come back home. So I came back home, and I wanted to make a difference here. And that has been my mission, to make the healthcare at SGMC be as good as Atlanta. And, you know, us have that same caliber of physicians here. So that's how I'm back.
Wow. Very powerful.
Yeah. I know. God, you make me want to cry.
Yeah. Well.
So we'll take it back to more simple things for a little bit. Let's talk about when someone should go to an ER or when maybe an urgent care, because y'all also operate, your physicians are in our urgent cares.
Yes.
And that's kind of relatively new. I mean, it's been around for several years, but becoming more popular.
Yes.
So how do patients decide when they should use an urgent care, primary care, urgent care, or ER?
Yes. Okay. I will say, I just want to give kudos to the community. They have done a really good job of choosing lately from all the publicity y'all done. But, you know, the Smith ER, Main, and the 2 urgent cares. So let's say like your son had a cut on his face. You know, depending on the time of day, that probably could have gone to an urgent care if it had happened.
Right at the time urgent care closed.
Right before
of course it did. I was like,
yes. But if it's smaller and you don't think it's a 1-year-old that's going to need sedation, that can't stay still, that's perfect for an urgent care. Or your child is at football practice, they roll their ankle. Is it broken or is it just a sprain? We have x-ray capability. Perfect for an urgent care. And of course, your coughs, runny nose, congestion, you need to get in somewhere quick because, you know, you're in the public school system, you need that school excuse right then. So you got to get in and get a school excuse. Yeah. And for those acute, treatments, things like that, the urgent care is wonderful for that. And then the Smith ER is great. Let's say you're 35 with chest pain. You don't really have any risk factors, but you're worried, I'm having chest pain. Smith's perfect for that, and you're, nausea, vomiting, gastroenteritis, and we can do most things. But if you are a transplant patient on dialysis, if you think you are having a heart attack, if you have stroke-like symptoms where you cannot move, one side of your body, that is what main campus. We have all the specialists and all the service lines, and that's when you go to SGMC, the main campus.
And let's talk a little bit about like triage. We use that word frequently because we know what it means, but the public doesn't understand that, and kind of how when someone does arrive in the emergency room, kind of how that process works. What does that look like? What's happening in the background that they don't see?
Right. When you're coming in the front door and you're coming into our lobby, let's say the main campus, and you're initially putting in your chief complaint, then you get pulled into a room for usually a nurse, and sometimes there is a provider out there too, and you're taking your initial complaint, vital signs, and they're giving you an acuity level, and it's 1 through 4. 1, you're coming right back. We think that you are truly having a life emergency, and 4 being this is simple. This doesn't require a lot of additional testing. That's a 4, and a lot of that's based off your vital signs. Someone whose heart rate's real elevated and blood pressure's real low. Of course, they're going to go immediately to the back. But if all your vital signs are fine, we initially put in those initial labs. So from there, we have lab techs that are up front, x-ray that's up front. So you get all that initial kind of workup. And then based as your results are coming back in, we triage that next acuity and moving you forward. Now, if we are, the ambulances aren't coming through the back, we move those directly to the room. But what people don't see, especially at the main campus, is we are a regional referral system, and we're taking care of Lowndes County and the communities. And that ambulances, we're at ground zero, which means every truck is out almost the whole day. And so a lot of times you're waiting thinking, why am I not getting back? But it's because those ambulances are coming in with the sickest of the sick, and they're going straight to rooms. And so that's how they kind of determine the acuity.
Yeah, and as our main campus is kind of advanced in capability, brought on more specialists, and formalized our trauma program, protocols, we are seeing more and more patients come from across the region. Yes. So more from that 15 county, even 25 county surrounding area for those high acuity and those things that they can't access closely in their region. So they're having to come here.
And just Lowndes County is growing, you know what I mean? And with that, and, our population is aging, and just the complexity that patients come in with, there's a lot of complexity. I think this week we have, I'm just thinking in one day, I think we put in 4 chest tubes that day. It was just the acuity is just high here.
Yeah. And talk about a little bit, why is choosing that right level of care important for us as a health system, but also for the patient themselves?
Yeah, because when you are choosing the right area to go, let's say you show up at the ER, it's something that could have gone to the urgent care, you're having to, it's your time, right? And you need to make sure that you're getting to where you need. But also for the healthcare system, not to lack of a better word, bogged down, but when we have a whole bunch of people checking in that might not need to be at the ER and we're trying to triage all them, do all their labs, it does put a strain on, some degree the ER of trying to get through all those patients.
Yeah, and I think that's why, as a health system, reopening Smith Northview ER was wonderful.
Yes.
But obviously that filled up just as fast as it opened. But another good advancement that's taking place right now is the new construction for the new emergency room and trauma center. And definitely something that's been 5 or 6 years in the planning stages, but we're so close to that opening. And tell us about what the functionality that will offer, just being bigger with capacity.
Yes. It's definitely going to help with capacity, and it's definitely going to help with those when you're coming in from the lobby standpoint, our ability to be able to see you quicker, do more. We've designed it that way. But what's really, I don't think everyone realizes that mental health is a real problem in Georgia, just really anywhere in the nation. And so right now, if you come in with those type of complaints, they're holding in ER beds. But in this new unit, we will have its own section that will be staffed kind of differently, held differently. So we'll have so much more bed space on top of that with that design. And more trauma rooms and better flow. And the flow is kind of designed for more kind of what you see more upstairs with the nurse and the patient rooms, more almost like a cubby with being designated closer to the patients, just to kind of facilitate quicker care. More bedside electronics right there in the room. The X-ray capability is going to be right there in trauma. I'm going to have to call for an X-ray. After I intubate someone, I'm going to pull it down from the top and take a picture. Everything's going to be cool. Just, I'm so excited about it. But I definitely think the community is going to feel improved flow, when they come in for an emergency. And then I think it's going to also alleviates probably some of Smith's burden. They see over 100 patients a day, right? Because sometimes it's hard to get in with us.
Mm-hmm. Yeah, that's going to be huge. I can't wait to see how that, once that's opened and utilized as it's built to be, the difference that's going to make.
And we're still on track to be completed at the end of 2026.
It looks amazing. I remember when I'm driving in, it's dark when I come into work in the morning, and I'm always and they're all the construction people are walking by, and I'm just don't hit anybody. I have my eyes out on the road, but they do a great job. Yeah. They've kept it looking beautiful, the whole site and the area that we walk by, and they are right on track. They might even be early.
I think impressed. They're doing a really good job to keeping things moving along, and because it matters, because the quicker we can get into that facility, the quicker we can start operating at a higher capacity. Yeah. And obviously, like you said, Lowndes County growing. The demand is just there.
Yeah. Well, just switching gears a little bit, you currently serve as the chief of our medical staff. So, what does that mean? What impact does that have on patient care across the health system?
There's a medical executive committee that's made up of physicians here. We have, you have your chief of surgery, and we have ER and medicine and a board. And essentially, being head of that, you get involved with more of, I say, day-to-day operations. I think I'm kind of the liaison of the medical staffs and administration. So when we're trying to grow and we're talking about, what we're doing next and what type of physicians do we recruit and what service lines do we need, I get to take a place in a lot of that, which I've really enjoyed. And I think Mr. Dean and I have a pretty great relationship. He's easy to talk to. We can talk about growth and vision and where we want to go as a health organization. And then it's really nice being able to go to the board meetings. I've learned so much going to those. That's how I realized 5 years ago the growth of all this was happening, and going to the strategic meetings, just learning about also just how much the health system is an economic impact on Lowndes County. I don't think I realized that to have a functioning economic fiscal important community, you have to have a great hospital system. Mm-hmm. Yeah. We are so responsible for the strength of the community fiscally too, right? That brings businesses in, and we're taking care of everyone, right? So I don't think I realized that until I got into this position.
Yeah, the not-for-profit status of the health system and how we truly are an organization that is built to serve the
Yes.
community regardless of their
Yes.
ability to pay. A lot of that but if we did not operate like that, where would those patients go?
Exactly.
I mean, and the fact that you have to make sure that you're sustainable and still growing and still elevating your level of care, but in a fiscally responsible way, so you can
Yes.
still be here.
Yes.
Because the last thing you ever want is for the health system to just go away because someone wasn't
I know.
managing it appropriately, and the responsibility. But I think we have a good team, that
Such a great
leadership
team.
team that comes and really rallies around that and understands that, and the medical staff is just phenomenal. So what's been most surprising to you serving in that role that you've learned about the health system?
I mean, I'm right now. I'm the only female sitting on that, and usually there's another one. But it's been. I appreciate that. That has been a respected role for me, right? I don't feel like when I sit down at the table, I'm being judged as the only female at the table, like a peer, and I think that they listen to me with my leadership ideas, which is it's been refreshing. I sat on Med Exec for 5 or 6 years as treasurer. And then I think it was Dr. Ziegler that told me it's time to put on my big girl pants and step into the next phase of the role that I was a little hesitant to do. He was like, but if you sit here and you're going to be a leader and you're going to be trained, you have to be willing to step up that ladder. So, and it's a 6-year commitment, right?
Yeah.
2 years chief of staff elect, 2 years chief of staff, 2 years chief of staff pass. So, but you have to have people that are willing to fill those roles. And so he kind of nudged me, but I've enjoyed it.
I wanted to talk about that too, like just being a woman in medicine. Like, what kind of progress have you seen over your career of,
Well, for me personally, it's been pretty drastic, right? When I came back here 11 years ago, most everyone that was practicing knew me as a child, right?
Sure.
I mean, I remember like coming in and the Millers would be like, "Hey, Liz," like they knew me as a kid. So that was a little bit challenging, right? To have to prove my almost worth, right? Like that when I called them with something that I'm competent, that I know what I'm doing, and I'm a physician too, and to be taken as a peer. So that has been an over decade process. But if you know me, I love a challenge. So I kind of took it to even work harder, strive a little harder to prove my worth a little bit more, because it's hard when you grow up in a town and you're from here, and then move into a leadership position for make sure that people understand where you're coming from. But I think I learned also doors open when doors are supposed to open, to not push on that door. So when I first started here, I was 30 and young, and I was eager, and I had to learn to also take a bit of a step back and learn from others and be mentored and develop my practice as a physician before I developed anything in leadership. Because, you have to have a foundation of, it's a lot different in residency than getting out and working. It's a big learning curve. So I'm thankful for the time I had when I first got back here, and to really just hone in as a physician and then progress more in leadership and operations. I really like operations. I don't know if anyone else is like, oh, I love operations. I just find it fascinating.
Yeah,
because
it's so dynamic.
It's so dynamic.
And healthcare is so complicated. Everything about it. So trying to remove whatever barriers you can to make it better for the staff and for the patients.
Agreed. And that's really what's led me to be in school right now. I'm getting my MBA in healthcare, and it's because I've enjoyed operations so much, and I wanted to get more, business degree with that and kind of develop it more, and I've enjoyed that. I graduate in May, 2 years.
Awesome.
Nothing like going back to school in your 40s.
Yeah.
I remember I had to write a paper. I was like, how do you write a paper? And, when we wrote a paper, it's completely different.
Yeah.
They have this APA format, and everything's done differently. And I just remember sitting down for my first assignment. I think it took me 10 full days to write my first paper.
Like, let me
And I was like,
this.
let me try. But, now I can write a paper.
There you go. Come back to the basics.
Yeah, that's right.
Is it interesting to you to see all the new female physicians coming now? I mean, now I feel like that's almost transitioned to where it's more female dominated than
Our
male.
residency classes have been basically split 50-50, male, female.
Yeah, I think that I don't want to say women can do it all, but I do feel like women's brains are tasked very efficiently for multitasking, right? And so I think that works really well in in medicine. And I think that that's what makes them excellent providers. And I think that nurturing side that's just kind of naturally in a female makes a really good physician, because you have that empathy. And of course men have it too, but it's just a little different of an aspect in healthcare. And I think that's what attracts females to it. I think that you want to help people.
Is there any particular like story that stands out to you, experience as a physician that you like just that really stood out and you're like, I'm doing the right thing? Like,
I think COVID, just the whole thing of COVID. I think that I realized that that was my calling, was to go into medicine, and we were the health of the county. Everything shut down. Even doctors' offices did. So the ER really was the hub of health for Valdosta. And it was interesting to see just how physicians in my group really stepped into this role of not knowing, were we going to be harmed? You know what?
Yeah.
And no one even thought about that. I mean, healthcare is just such a calling. And we were like, we put our mask on and we got out there and like we took an oath to serve and to take care of others before ourselves. And it's kind of a little bit, I always tell people, residency is a little bit militant, right? Like you're working 80 hours a week and you're working for a purpose and you have this group, camaraderie, and you're almost like fighting for something. And when COVID hit, I was like, this is what we're training for. This is why we're here. And I got to really take care of a lot of people in my community, when they were at their sickest. And it was scary. I think everybody has a little bit of almost PTSD when you think of COVID. You don't really want to even talk about it. But I think that really was a turning point. Also in my career, it's where it kind of launched me into leadership because, I was here.
Yeah.
Right?
Yeah.
So.
Yeah. That was a very challenging time for
Yes.
everyone. But I do think a lot of strength was shown
Agreed.
and displayed through that you could never see and recognize fully without something like that happening.
Yeah, agreed.
Any misconceptions out there about ERs or anything you hear, like maybe just something that you hear, that any rumors that you want to dispel?
I think it just in
like,
general, I think the wait time is the main thing that I think we all hear, like, why am I not getting back? And I do think the larger building will help that. But I do want people to know that even though you're out there, stuff is being done, and what's going on in the back is sometimes, it's life and death. And it's not really sometimes until you get into the back, that you realize, oh my goodness, this was what was going on. And also I think that, I don't know if people realize just the caliber of ER physicians that we have. And here, I'm probably the least qualified. I have done everything to recruit above and beyond me. Everyone that's at the main campus is board certified. They all come from, UF and MCG and Emory, and they are so well trained. And, we take our group against any of these major hospital systems, and they're more educated with more experience. And also, they're just great people. I think everyone makes sure they take a tour through the ER when they're trying to recruit someone, because the vibe is great, And that's like with the staff. My nurses are wonderful. My techs are wonderful. They take great care of me. The physicians are amazing. It's a very cohesive group that you might not realize. You think the ER is chaotic. But the few times my friends have had to be ER patients, they always talk about how people are working together and genuinely happy together, and how kind the physicians are. So, we've worked really hard to recruit just that. I don't want to be at work all day with someone that I'm not enjoying being around, who's might take care of my son or my daughter and isn't well trained. So if you get it's a culture. If you get in an ATV accident or you're having a stroke, I want to make sure you're in the best hands.
Absolutely.
Yeah.
It gives you some peace of mind.
It
to
does,
know that.
and it gives me great peace of mind. My mom was hospitalized here for a very long time with COVID, and the ER doctors run the codes and go upstairs, and I just remember every night just knowing I could rest easy. You know what I mean? I just knew that she was in good hands, that whoever was down there that night would be taking great care of her, and that it matters. It matters. I really do treat who we recruit as would I want them taking care of my family. And I can say there's not a single person that works with us, mid-level physician, I'd let any of them take care of my family.
And that's important for like emergency services in particular,
Yes.
because while you can shop around for specialty care for certain things, when
Correct.
you're in an emergency, you
We're what
don't
you got.
you don't have that luxury.
Exactly.
So to feel comfortable and know that you have that right here, so that should it happen.
And that's
you've
probably
got
what sets our urgent care
team.
apart from other urgent cares, right? I mean, you might see other ones in town that don't have the SGMC name, but when we train for the urgent care providers, like the APPs, they own an intensive, like 3 months at minimum where they're training with us, and we're making sure they have all the skill sets, and then we're doing boot camps with them, and I don't put anyone out in these facilities that I want them to know what to know and what not, like don't miss anything, know when to refer to the ER. So I really train them a lot in the ER, so they see the sickest of the sick, so they can recognize what sick is and get them to where they need to be. And then, you can take care of the cough and cold, but you don't want to mix someone who's septic.
Right.
You have to be able to
Absolutely.
recognize those signs. And I know some of the other practices in town, they've never worked anywhere but in urgent care. They didn't get
Right.
any training. They went straight from school into a place where they don't have any oversight. And so I take that very seriously, the oversight of those facilities
And
and
the
the
continuity
training.
of care it brings
Yes.
too, just knowing them being familiar and well versed in both arenas, I think that's
Yeah.
unique
It is unique.
and a benefit to the patient.
Yes.
And it's so nice to have multiple urgent care options
so
as
nice.
well. We have 2 urgent cares right now, and you can, check the wait times on your phone before you go and see maybe which one's closer or which one has a shorter wait.
Oh no, I did just that. My kids had the flu over January, and I was like, I logged in. I was like, okay, take him here, Tony. I was at work. I was like, we need to get a swab. I didn't know if it was strep or flu or what, but we had flu A and B. Lucky us.
Fun.
Yeah.
Yeah, I think we got that too.
Yeah.
Well, I actually didn't take them anywhere though, because I was like, I just knew it was the flu. Probably,
Yeah.
I was like, we're gonna just medicate. But that function was put together because we were like, we know as busy moms,
Yes.
you don't have time often to
don't.
wait, and you, if you're working and you're trying to get for things like that, that's what makes urgent care so great, is that you can get in and out very quickly. for
Open
those things
every
that-
day and after hours, after work, open until 7:45 at night. So
And their door to dispo is under 60 minutes consistently always. I mean, that is so impressive. And
Yeah,
most
that is
and
amazing.
I mean, we were 25 minutes. I mean, from the time, and it wasn't any special treatment. I mean,
Right.
it just flows that well. They immediately get you in, they get you swabbed, you get the results, you're out the door. It's Mandy and Lynn, they have a well-oiled machine at those facilities,
Yeah.
and the staff there. That's why my providers like working there so much too. They love the staff.
Yeah.
They're such a great group.
Well, and for the patients too, just having access to my chart to like being put in that system. You'll probably get your results before you actually
do.
leave. You're still sitting there before they come and tell you what they are.
Yes.
But
love
again, adding that benefit of putting all the provider information and stuff together into one system, so then you have it all there and can
And I
look
like
back.
because when I walk in to update the patient, I like when they have their stuff up because they're seeing these reds and it's scary to them. And I want to be like, that is just literally the size of your red blood cell. And that does not mean anything about being anemic. That doesn't mean that you're in bad health. I was like, that is just literally under like a microscope. I was like, do not worry about that. But they would go home and worry about it. And then they're Googling, what's an MCV? And I'm like,
Yes.
don't Google that. Like, it's okay. Like, so I like that they can get on their phone because I would never in a million years think to communicate that result to them,
Right.
that would give them fear. But when they see Reddit, they're scared. They don't know what that means. So I like, and often now because I have the DAX, I use the AI where I can go in there and I can record my conversation, and so I can see the labs in the room. So I pull up on my phone and I can show them in real time. Hey, this is what we're getting back.
Yeah.
This is what I'm thinking, and it's nice for the patient.
Well, I think it just also helps that patients are educated. I mean, it
Yes.
helps them become more intimate with their own
Yes.
health care and understand it more, ask those questions that they have, and it facilitates that conversation with y'all. So I think I feel like we're going to continue to move in that direction
Yes.
as patients evolve and have access to more of that. But I think that's important to their
I
care because I
agree.
feel like kind of in the past, you know, it was all a big mystery.
And people
you know,
wouldn't
you
ask
just kinda-
questions, right?
Yeah.
It was almost intimidating. Like they were afraid to ask, like as if it was rude, or I'm like, ask away. You know, like I want to answer your questions and give you some ease. And so I think that having that interface allows just an easier communication, because they're like, hey, I saw this lab, and it's not just like, well, what's wrong with me? So
Yeah.
I think that helps.
And then everybody being in the connected network, you can go back to your primary care doctor and they can see your labs and, you know, maybe.
I just love that.
Yeah.
And it's so nice and epic. I can just click on and I can see everything they did in a doctor's office, the cardiology office, and it just makes things so nice. I mean, I literally called, you know, Dr. Hovde or Dr. Marino routinely to be like, hey, I saw that you're doing this. I found this today. Can you follow this up for me? Absolutely. And they're so good about getting their patients in for quick ER turnarounds. All the doctors are. They come to the ER and I'm like, I really would like them to get seen soon. They get them in soon, which is really nice.
That's cool.
Yeah.
All right. Well, any kind of advice you want to give to maybe anybody just thinking about becoming a physician? We know that they're rare around here, and we're trying to build that workforce, or just even getting in the medical field in general, maybe in a different specialty. Any advice you would give?
I think that if you're in the high school age, I definitely think getting involved with something like that volunteer program.
Yeah, your daughter did
I
it
know,
last
my
year,
daughter
right?
did it, and now I think she wants to be an ER physician. She had a very similar
Following in her
first
mom's
experience
footsteps.
that I did. She had somebody that was in cardiac arrest. I just looked over at her during it, and I was like, "Oh, that's the face I had."
Oh, no.
And I was like, "She's going to love this." And I just remember sitting down afterwards, and she was like, "This is amazing."
Yeah.
And she got to see so much amazing stuff over the summer and learned so much. And I just think that it really, you know, took her to the next step. And like, no, it's nice to have a goal and a drive. Like, why are we studying in high school? Like, what's your purpose? Like, I am
Yeah.
just so task oriented, and I really just felt like it made her just like hone in. Like, I'm working towards something. This is what I want to do. So I think getting involved early is important. And then I think, especially as a female, what do you want to do? Do you want to be a mom later in life? Like, what are your goals later in life? And then finding a career that allows you to do that. So, I mean, I think like a lot of physicians that are especially female get there and they're like, well, how am I going to have a family and practice? So it's either choosing a career that's more of a 9 to 5, or like in my case, I just was very blessed with a husband that has taken a kind of a back role and gone and cared for my kids so that I could pursue what I wanted to do, right? I mean, the shifts start at 6, you know, most days are 14-hour days. I can't pick them up. I can't, you know, get them to their after school events. You know, when I'm gone, I'm completely gone. So I just think that it's important to realize that choose the right, you know, if you want to go into medicine, because it's a lot of work. You know, as we take these medical students on, you know, you're not paid. We do it because, you know, we're here we were in their shoes and we want to get good training and we want them to be trained well. So it's a lot from medical student to residency to commit to training someone into their 30s to become a physician, right?
Yeah.
So it's a big, you know, lifetime commitment.
Right. It's a commitment. Yeah.
No doubt.
So planning ahead.
So you might need to go into dermatology if you
I
want
mean,
8 to 5.
I mean,
like,
but if you want
pick your
that
specialty,
lifestyle, you need to
dependent,
think about it. You know, there's a reason that most ER physicians are male.
Yeah.
It's you know, the shift hours are a little bit harder, but when I'm off, I'm really off, and I get to be present. And I have such great daughters I work with. Like, it was my son's last baseball game for the year yesterday, and it was supposed to be today, and so I had taken today off, but not yesterday. And one of the docs came in and worked the last half of my shift. And that's what's so nice about, you know, having so many doctors that live and work here. We have that flexibility. I cover for them, they cover for me. So that's nice. So you can do it, but you got to plan ahead.
Yeah.
Yeah.
All right.
Well, one final question.
Yeah.
You're here a lot in those long shifts. What is your favorite meal to eat here?
Oh, that's going to be so boring. You know, I eat a salad every single day. Okay, so I'm such a big proponent of that salad bar.
Yeah,
but
I love that
I'm
salad
just
bar.
saying, there's something to spinach, right? I mean, it's such a healthy food. And then I love the protein choices that are on there. And in particular, I'm a big fan of eggs. When we had that egg shortage, I remember calling Hillary. I'm like, Hillary, can we get the eggs back on? Can you reach out? Like, I know they're expensive, but when can we have them back?
Yeah.
So, I mean, that's that. But, the food services here is amazing. You don't know how many people I discharge from the ER, and I'm like, because they've been doing all this testing. They haven't eaten, right? They're starving when they leave here. And I'm like, can I get you something? What's your plan? Like, I don't want you to drive. You haven't eaten for 7 hours. And they're like, oh, I'm going to go down to the Spice to the cafeteria. It's wonderful. I'm like, I know it is. That's another recruitment thing for here. They come here and they eat here, and the physicians like, the food's amazing, and we eat so much here.
Yeah, right. I know, because you don't have time to go anywhere to go eat. Yeah,
you don't. And so the food quality here is wonderful, and I do think it's nice that we have some really good health choices. I think I was the one that pulled the ice cream machine out of the physician's lounge during COVID. I was like, we need to be healthy and functional. I was like, and they were like, who pulled that out? I'm like, me. I'll eat ice cream.
Sorry. You might have somebody after you.
I did. They know. They know.
Okay.
They got protein bars instead. And they were like, "What's with the protein bars?"
Sometimes you just got to make a hard,
Yeah,
hard
I'm
choices.
like,
Just do it.
you
Just do
have
it. There
some
you go.
healthy
It's better for
nutrition.
everyone.
Yep.
Yeah.
Well, it has been a pleasure
Yes.
talking to you. Thank you so much for all that you do for our health system, for our community, and
Thank
for our
y'all.
patients. Phenomenal work. And so I was just glad to be able to have you on and be able to talk about that a little bit more. So
Thank
appreciate
you. The dream team here, so I'm happy to be here.
Thank you. And thank you all for listening. If you have any questions or any topics you'd like for us to touch on, you can let us know at sgmc.org/podcast. And don't forget to like and subscribe.